Hi there, it's Claire Thomas with another presentation on how to beat yeast infection at home. This presentation is entitled The Link Between Yeast Infection and Diabetes. So we're going to look at how yeast infection affects diabetics and what you can do to try and eliminate yeast infection as quickly as possible. So let's examine why does being diabetic make vaginal yeast infection more likely. Over the course of their lifetimes, the majority of women will experience one or more yeast infections. There's a particular risk for women who are diabetic, since this affects the yeast infections or the yeast cells normally present in the vagina. Usually the small amount of nutrients in the vagina's acidic surroundings keep this under control. Diabetic women, however, will have a higher level of sugar, or more precisely glucose, in the secretions from the vagina. This is because their blood is also higher in glucose than normal people. This surplus of glucose, helps actually feed the yeast cells, which then increases greatly in number, causing an infection. This should be prevented by the body's immune system, but the immune functions are actually affected by hyperglycemia. It's sometimes the case that one sign of an infection elsewhere in the body is a sign of a yeast infection. Alternatively, it may just mean unstable levels of blood glucose. So what symptoms do vaginal yeast infections have? Well, there are several common signs of this type of infection. It may actually hurt to have sex or during coitus, and it will also be painful to urinate. Sometimes there's an unpleasant odor. You will also experience you may experience a cottage cheese-like white secretion, an uncomfortable itchy sensation near the vagina are also common symptoms as well. Even so, not all women will see any symptoms, so it's possible for yeast infections to show up in places like the mouth, where it's more commonly known as thrush, within the folds of the skin, or certain parts of the feet. So these are other signs that you need to look out for as well. So how can you tell if you have a yeast infection? It's necessary to have a medical examination which will check to see whether there may be another reason for your symptoms. These may include sexually transmitted diseases or bacterial infections. Yeast can be spotted by looking at a sample of your cells under a microscope. In a number of cases, additional tests in the lab may be required in order to give a definite diagnosis. So what effect can yeast infections have on diabetes? Well, your body is naturally protected against infection, but these defense mechanisms are blocked by yeast, including in the vagina. A diabetic woman with a yeast infection is more prone to getting additional infections. The reason is that high blood glucose levels and yeast taken together make it harder for your body to fight against viruses and bacteria. Since the infection fighting process can lead to large variations in blood sugar levels, infection is a significant danger for diabetic people. So how can yeast infections be treated? Well, there are a variety of antifungal medication that are actually available, both by prescription or over the counter. These are effective for use for diabetic people. So before you begin to take any medication, you should consult with a healthcare professional to check that oral antifungals will not affect any regular medication that you may already be taking. An alternative to oral medication is to use vaginal medication. Research has suggested that 2 weeks treatment may be needed to treat a yeast infection within a diabetic woman. Nystatin and other oral and topical antifungal agents can be obtained by prescription. These can be used against yeast infections in other parts of the body as well. If you're a person with diabetes who is fighting a yeast infection, it's very important to follow the instructions that your healthcare professional will provide. You should always take all the medication that has been recommended, because it can be dangerous to finish a course of medication early, simply because you think you feel better or you feel stronger. So always ensure that you finish the course as recommended or as instructed. Not finishing a course of medication can lead to your infection coming back in a more serious manner. So make sure you follow the instructions and make sure you complete the course. So what should women ask from their healthcare providers? Well, as soon as you have a solid diagnosis, you should ask about what treatment options are recommended. As an example, you can ask whether oral medication or vaginal cream would work best. If you suffer from several yeast infections within a year, usually if defined as being 4 or more, then it's a very good idea to ask for a diabetes test. So this is because excessive high blood sugar can be the cause of a yeast infection. So thanks very much for watching. That concludes this presentation. If you have any comments to make or any questions, or if you'd like a bit more in-depth discussion about this presentation, please feel free to email me on one of these two email addresses, and I'll be happy to respond as quickly as possible. But once again, thank you for watching.